News. Dr. Tam, some pictures from Vancouver this week show packed beaches full of people again. That province has moved forward with some very gun-ho openings. Yet now in South Korea, a country that's been recognized as having this more under control or getting it under control, is putting restrictions back into place and locking certain businesses down. Do you foresee us having to do that as well?
I think, as you know, the Chief Medical Officer of British Columbia and everywhere else in Canada are being very cautious. Now, the public, having contributed greatly to our efforts, must be reminded that we're not going to be back to completely normal, sort of pre-January of this year. And that if there are gatherings of that nature, of course, it's up to us to constantly remind people that that is not the public health advice. I think the advice is to go outdoors, but you got to observe social distancing measures. So it is going to be difficult, I think, because people have heard these messages for a very long time, but we still got to sort of ensure that these habits that may have been instilled continues. So that is still going to be a key part of the response. If there were any uptick in cases, the loosened public health measures may have to be sort of reinstated. We do not want that to actually happen. So I think everybody continues have to listen to their provincial or local public health officers, because this is serious. The virus has not disappeared from the face of the earth. It's still circulating in some parts of Canada. So it is something that is going to have to be a sort of ongoing behavioral shift, which is not an easy thing to do.
And Canadians now are still allowed to travel between cities, between provinces. How is that going to affect reopening? If one area reopens, certain businesses, sectors, recreational facilities, and another doesn't, but people can still travel freely, is domestic travel not a risk to those areas that are reopening?
So this is why you need the national linkages, because you have to share information to know where cases are. But that is true that if there are outbreaks in certain areas, other parts of Canada is going to be looking at whether there's any travel-related cases, so and reevaluate that. And so I think that is absolutely something that we have to watch for in the next phase. In terms of domestic transportation, Transport Canada, for example, has instituted certain measures, including the wearing of masks. Some jurisdictions still have measures in place for anyone traveling outside of their provincial jurisdiction. So they have particular provinces that haven't seen cases or haven't seen transmission, but also if they have a smaller healthcare system or service, they're going to be protecting those areas, including people coming from other parts of Canada through domestic travel. So a number of jurisdictions still have that in place, given their own epidemiologic situation. But that will, again, have to be reviewed as in the coming weeks and months.
Thank you, Doctor. Ceci met fin à la conférence de presse. Merci.
This brings this press conference to a close. Thank you.
Merci. La conférence est maintenant terminée. Veuillez raccrocher votre ligne à ce moment. Nous vous remercions de votre participation. Thank you.